Good day. My name is Imelda Williams. With this presentation, I'm going to give you some guidance on how to complete your clinical portfolio. I would also like to acknowledge Tony Smith, who is the other academic that supports this unit. Monash University recognizes that its Australian campuses are located on the unceded lands of the people of the Kulin Nations and pays its respects for their elders, past and present. So with this slide, I've given you the contact emails for both myself and Tony. It is the best way to get hold of us because we are not always available via phone. So the resources that you will need to complete the clinical portfolio, of course, your main resource is the Moodle site, and you will find the clinical portfolio Moodle book under week 1, which is the week that starts on the 3rd of March. And in that portfolio, there's a number of documents that would be quite helpful when it comes to the time that you have to submit your portfolio. You might also find that during the course of this delivery of this unit, that there are information coming from the other Moodle books that would be useful for you when you compile your portfolio. This introduction PowerPoint presentation, of course, can be found also under week 1. So the clinical portfolio is a competency hurdle, which means that you need to pass the portfolio to enable you to pass the unit. If you do not pass it at first instance, you will need to resubmit, and then it will be capped at 50%. The overall weighting for the clinical portfolio is 30%. It has 2 parts to it. So the first part is a compilation of at least 25 clinical cases, and I'll talk more about that. And then the second part is undertaking a self-auditing of your preliminary image evaluation. The submission deadline for the clinical portfolio is on Wednesday, the 25th of June at 5 to 12 in the evening. So as mentioned, the clinical case will require there's 25 cases. Each case is worth 4 marks, and that means that the overall mark for that part of the clinical portfolio is 100 marks. So the word count for each case is around 80 words. So the overall word count is 2,000. So don't stress about the 80 words per case, because some cases you might write less and others you might write more. You, of course, have to focus on the body regions which are applicable to this unit, which is the pelvic girdle, the lower limbs, the thoracic and lumbar spine. It's really important when you submit your cases that you include both abnormal as well as normal cases. There is a tendency to have very few normal cases, and if you do that, it will actually affect your specificity, because say if you, for example, you only submit 2 normal cases and one of the cases has incorrect information, your specificity will be very low. Because this assessment requires your knowledge that you need to demonstrate, generative AI is not allowed. So what things that you need to consider for your cases is the mechanism of injury or the clinical indications and symptoms. You have to include at least 1 de-identified image. You can, of course, include more than that. And then write up your own preliminary image evaluation without looking at the radiologist's report. Once you've done that, then only compare your PIE to the radiologist's report. Now, remember, you need to answer the clinical question. The radiologist often writes more than is required, but only mark your case against that. If applicable, and this is not a requirement, you can mention the immediate patient management. You can also use references to support your discussion, but again, that is not a specific requirement. So the marking rubric for the clinical case, so the criteria that we're looking at is the presenting symptoms and then appropriate description of radiographic appearances. And for that, you can use the ABC search strategy. However, you don't need to use all of the ABC search strategy. So for example, if there is a fracture of the knee and there is some malalignment, you would then include A alignment, B for bone, and then if there's any soft tissue signs, but you don't have to include the whole of the ABCs. Important then with your PIE, once you've written that up, is to compare that to the radiologist's report and then to include at least one de-identified image. And as mentioned already, each case will have a maximum of 4 marks available. So this is an example of how you can write up your clinical case, and I would really encourage you to use this example. So the first thing that you need to do is actually to identify which case you're referring to, because often the students do not number their cases. So in this case, this is number 10, which body region this case is applicable to. So here's an ankle, and the clinical indications were that there was pain and swelling after sustained after kicking a ball, and then at least one image included. So the PIE report indicated that there was a Salter Harris 4 fracture of the left medial malleolus, and there was an anterior teardrop sign which indicated joint effusion with significant soft tissue swelling. When comparing that to the radiologist's report, the majority of the report was consistent. However, the Salter Harris type was incorrect. The radiologist stated that this is a Salter Harris type 3. So when you then work out your true positive and true negative, so for true positive, then the majority is okay, so it's about 2/3. And then the false positive for incorrectly identifying the Salter Harris, and that made up 1/3. So the second part is the self-auditing PIE record, and for that there's a maximum of 20 marks available. So once again, only focus on the body regions for this unit, the pelvis, the lower limbs, thoracic and lumbar spine. And I have to reiterate that you must also include normal cases with your abnormal cases. So in your PIE report, as mentioned, relate the report to that of the clinical indications. For example, if it's trauma and there is a fracture, however, the radiologist might pick up on some indications such as osteoarthritis, you can ignore that part of the clinical question. However, if something has been picked up which is not related to the clinical question but still important and significant, then you have to mention that. So once you've done that, look at your PIE report and then assign. True positive would mean that you and the radiologist agree on all aspects of the abnormality. A true negative would be where you both agree that this is a normal case, and then false positive, so that's where you incorrectly identify positive findings, and then a false negative is where you indicate that this is normal and it's actually not. Now, it might be important to assign fractures. So, for example, where there's 2 fractures, you only identify 1, then you would assign a 1/2 mark true positive because that correlates with the radiologist, but then a 1/2 mark for false negative because you've not identified the other part. So you actually call that as normal. But remember, each case must be equal to 1. And also remember, if you have a case where there's more than one body part, so say, for example, where you have the ankle and the foot, write it up as 2 separate cases. So then you need to calculate the following: your sensitivity, which is concerned with your ability to identify abnormality. Specificity is to exclude abnormality, and accuracy is the overall accuracy of your image interpretation skills, and that is 15 marks. And then provide a brief reflection on your personal image evaluation abilities. And it could be that you identify that you still struggle to identify, for example, certain pathologies in the pelvis, or that you have throughout the course, you have really increased your understanding and image interpretation skills related to these body parts. So this is just then a summary of the fractions that you need to use. And then here is a spreadsheet that can be used. You will, of course, add more rows So you need to have at least 25 cases. So if you have 25, that's the total is 25. And because each case can only be equal to 1, so across the true positive, true negative, false positive, and false negative for each case 1, it means that when you add all of this up, it should also be equal to 25. So this is a decision-making table. It's called a 2 by 2 table, and it's basically putting the radiologist report, which is the gold standard, against that of the PIE report, and then the positive findings, which would be true positive or false positive, and negative, which would be false negative and true negative. So specificity then is the ability to identify that cases are normal, and you want to keep that as close as possible to 100%, because if you don't, you will increase your false positive rate, and that means that there is a higher risk for associated either unnecessary treatment or unnecessary imaging of that body part. And then accuracy, which is a true reflection of your ability to identify pathology, but also to identify all normal cases. So in summary, you need to collect a range of clinical cases that covers the body parts. If you struggle to find specific body parts, please email us. Remember to also include normal as well as abnormal cases. And if you have any issues with completing your clinical portfolio, please feel free to contact either myself or Tony. Thank you.